Doctors Without Borders has raised concerns over what it calls the persistent and systematic physical blocking of non-South Africans from accessing healthcare. MSF is making the call for immediate action by the National Department of Health and relevant provincial departments to guarantee the right to access healthcare for all, as enshrined in the country's constitution and the National Health Act. Joining us in studio to unpack this further is Claire Waterhouse from Doctors Without Borders. Claire, very good evening to you. Welcome. Thanks for joining us.
Thanks so much for having me.
I mean, you've expressed concerns regarding the exclusion of non-South Africans when it comes to accessing healthcare in South Africa. Perhaps expand on some of those key concerns that you want to highlight.
Yeah, sure. So I think it's been, as we know, these issues rise and fall in South Africa over time, but over the last couple of weeks we've been receiving a significantly increasing number of reports from people who've been unable to access really quite important healthcare. So last week we undertook an assessment in Gauteng to try to understand the problem better. We visited 15 facilities in total, and we found that more than half of them had physically blocking elements by anti-migrant groups who were preventing patients from accessing the care that they needed, which is obviously extremely concerning because they need to access this care. People need to seek treatment, and now they are either unable to do so or afraid to do so.
What have you found to be the immediate health consequences as a result?
So we spoke to around 50 patients as a part of this assessment, and what we found is that they reported more than 24 facilities they were blocked at. Health consequences, primarily what we're seeing, or what we're most worried about, let me say, is pregnant women, particularly pregnant women with complications like HIV, like diabetes, high blood pressure, children and babies. We saw at least one baby being denied access to healthcare, a 6-month-old baby with a respiratory infection, which, as we know, it's winter in South Africa, that can get very serious very quickly. And then, of course, chronic patients. Of particular concern in South Africa is HIV patients, because we know that if you default from your HIV medication, that can have serious complications, which affects the whole of public health.
So perhaps let's talk a little bit about why we're seeing this movement. I mean, the various movements heading to healthcare facilities across the country, the perception that migrants are overburdening South Africa's healthcare system. How does MSF respond to that narrative? And I mean, does your data actually show that, if you have to look at the numbers and assess the situation?
Yeah. So as a South African myself, I completely understand why people feel frustrated with our healthcare system. I understand that there are real challenges, but I think what's happening here is we are blaming the wrong people. There are problems in our health system, and it's okay for us to admit that and to talk about that, and we should be addressing that daily, and communities should stand up for these issues. So absolutely, I'm all for active and involved communities. But what we're seeing here is very vulnerable people being punished for actually issues that are more structural, that are related to resource management, that are related to other kinds of issues, you know. So if for us, it's a question of everyone who needs to access healthcare is a human and has that right in South Africa. Whether you like that fact or not, it is true. As for the burden, there's a lot of misinformation out there on the burden of how much migrants take up in the health system. But the estimate is that they are not more than between 4 and 7% of the population. It is true that in big cities and big metropolises like Gauteng and KZN, which is where we're getting most of these reports from, there tend to be more migrants, therefore there is a higher visibility. But they are still a small minority of the people who seek healthcare services in South Africa, despite what other sources might say.
So what would you like to see happen as you call for immediate action? I mean, you speak about the most vulnerable, and you know, right after this, I'll actually be getting response from Operation Dudula, who have been talking about how they are barring non-documented foreigners from accessing healthcare, and that, you know, if you have health issues, you should be able to pay for it.
So I think there's maybe two misconceptions to address in that. Firstly, we know that they are blocking both documented people who have permits, who have visas, who have the necessary documentation being in South Africa, and also this thing of that they're not paying. in primary healthcare is free for everyone, of course, but at hospital level, foreigners are either subjected to the same means-based testing as anyone else and required to pay accordingly, or if undocumented, they are actually charged the highest possible amount. So I think that's important to know in this.
Is this at public hospitals?
Yes, yeah. Of course, there is the private sector, but I think we need to remember that that is unattainable for the vast majority of our population. It serves a very small, very privileged few. It's not affordable for most South Africans, let alone people who are not from South Africa. Yeah.
Very well. Okay, so as we wrap up, so you want to see some sort of action from the health department?
Yes, so we really don't feel that the health department is taking this seriously enough at the moment. To have physical blockades across more than half your health facilities in the massive, most massive population in South Africa and Gauteng is not acceptable. So the health department needs to take urgent action. They need to condemn this. They need to start clearing these facilities, and they need to address also facilities that are working with these anti-migrant groups, which we have seen in at least 2 facilities where healthcare workers were collaborating or colluding with these groups to enable their work, which is obviously completely unethical and unacceptable. So we need the provincial departments, we need the national department to come in and be strong on this, but we also really need them to engage with communities to understand why they're having this level of frustration. We need to explain to South Africans why this right is inalienable to health, and what, the negative consequences of ignoring a right like that would be serious for us as a society. But also they need to be working with communities of foreigners now to say it is safe to come back once these facilities are cleared, because now people are scared, they are traumatized, they don't want to come back. We've even had one patient who told us she wants to terminate her pregnancy because she's so scared of how she's going to find treatment for that. And that's a terrible position for a mother to be put into. So we really need them to be working with communities, both South African and foreign, to be able to say, this is what we need to work on. Let's find longer term solutions.
Okay, thank you so much, Claire. Thanks for speaking to us about this. Claire Waterhouse from Doctors Without Borders, unpacking that aspect, calling for the Department of Health to do something and stand up to ensure that there is access for non-South Africans in public healthcare services. Now, we're getting some response from Operation Dudula President Zandile Dabula, who joins us on the line for reaction to this conversation. Zandile, very good evening to you. Thank you for your time. We've just had a discussion with Doctors Without Borders' Claire Waterhouse, who says, something needs to happen, because your controversial campaign has sparked national debate and raised some serious human rights concerns. What is your reaction to the MSF?
Hi, good afternoon to you and to the viewers at home. Thank you so much for this opportunity. I'm glad when, organizations such as MSF are coming on board, because I think these are the right people that need to help migrants, but obviously the legal ones, because we are still saying that public facilities are only for South Africans. If migrants want to use these facilities, they need to go pay for them. But unfortunately, because we are having a broken system that will not even have any methods of payment, especially in the clinics. Yes, at the hospitals there is that option, but at the local clinics they don't have. So if they go to hospitals, they must pay for it, but they must be legal. And if they are clinics, obviously they will not even have access to the public clinics. So the likes of these organizations, they can go out there, pull up tents and help the migrants if really they feel that we are inhuman, because we've been saying this for the past almost 2 months now, that it's got nothing to do about feelings. We're talking about laws here. If you come to this country and you are documented, you'll have your medical visa certificate. If you are undocumented, definitely you will not have. That's the same reason why you need to be deported back home. But if it is an emergency, we will make sure that you get the necessary help, but then you are handed over to the law enforcers. The problem here is that we have officials that are not doing what they're supposed to be doing. We needed to have, we are expecting that now that we've started this campaign, communities are seeing the good results of this. We needed to have immigration officers and law enforcers in these healthcare facilities so that when people get help and they're undocumented, they must be deported back home. But we're getting pushed from the department. That's the same reason why we we called a meeting with the Minister of the Health Department to say, because we want to tell him what needs to happen, because we cannot lose so much money on people who are not South Africans. They are being prioritized in all of these things, and our South Africans are suffering. Just to make an example.
Yeah, Zandile, before you make your example, let's talk a little bit about the structural factors. The MSF has spoken to, a very small ratio of foreign nationals, undocumented foreign nationals accessing public healthcare facilities in South Africa, talking along the margins of 4 to 7%, saying that it's a very small amount. And you have mentioned some challenges when it comes to payment systems, saying that they're not consistent across all the public healthcare facilities in South Africa, and that officials are not doing what they're supposed to do, which points to a common factor between what you're saying and what the MSF has said, that the issues are more structural resource management issues that need to be addressed on that level, and so that this can be resolved. What do you see as a long-term solution here? Because you're speaking about how you will allow South Africans to access these facilities in the event of an emergency. The MSF on the one end has raised concerns such as, people being scared and traumatized to access these facilities. One woman saying that she's going to terminate her pregnancy because she's afraid and she can't get access. HIV/AIDS patients who can't get ARVs and so forth. So, my question then. Yeah.
When you are pregnant, we can't take it as an emergency because we have the whole 9 months planned for the delivery of your child.
Yeah.
So we are sitting in a situation where you find a woman who's about to give birth and comes to South Africa to make sure that she gets that service, a free delivery in South Africa. It cannot be correct. It's not an emergency that you can plan. HIV treatment and any other chronic illnesses, that's something that you visit, the healthcare facilities probably every month, or it depends on whatever date that you receive. Mm-hmm. So that's also planned. It's not an emergency. We cannot be abused and allow people to be abusing the system because they're taking advantage of the broken system that we have in South Africa. Unfortunately, the likes of our organization, Operation Dudula, March to March, and other patriotic movements will have to stand up because we can see that our systems are being abused because not even the president of this country wants to address this matter. We are not inhuman. We are saying that people can access healthcare facilities, but they can go to the private ones and pay for it. If they want to use the public ones, they must pay for it. But unfortunately, at the local clinics, there is no method of payment. Then it means they must just go to private facilities. But the likes of MSF, they are more than welcome to assist with this regard because the taxpayers' money must only be reserved and help the people of South Africa. I mean, I'm gonna just make one example of a 60-year-old who have to go and queue as early as 5 a.m. in the morning, and yes, be attended to, but sent back home without receiving medication because someone else, a non-South African, and too many of them have already received the medication that elderly South Africans had to get. And the saddest thing is that we have seen, and it's proven that these people take the medication, they collect medication from different facilities, go and sell them in their respective countries. So who is wrong here? Who is inhuman here when somebody is desperate needing that medication, but somebody takes it and go and sell them in their respective country where they come from just to make profit? So it's not correct. It's crime what they are doing. It's treason what they are doing, and we cannot allow it.
And very quickly, Zandile, before we let you go, with the notion then that the state has failed to allocate and use resources effectively and that the system needs to be fixed, when are you speaking to the health minister? Something's got to give. I mean, there's got to be some viable solution to this.
So we're meeting the Minister of the Home Affairs tomorrow, which is the 11th of August in the afternoon. But we don't need to be getting any more resources. Yeah. If we can have South Africans getting help in these public facilities, it would be enough. Because remember, when the government prepares their budget, I mean, census is giving us a particular number. So I'm just going to make an example that, for instance, let's say we are 10,000 in Gauteng. The Treasury will then receive the budget of 10,000 people from Gauteng, and they will be provided for. But what we see is that because we are more than 10,000 in Gauteng, the medication will finish before even 6 months, before even the 6 months end, because there's no capacity, there's not enough for probably 20,000 people. So it cannot be correct. I mean, the system needs to flow correctly. And once we have all systems in place, having South Africans receiving these medications, then we would not be short of a medication. I mean, we've been to GP clinics at other times and asked, the healthcare workers that, how many times do you guys order medication? And they say they order medication every week. And since we have started, I think there was a time where they haven't ordered for about 2 weeks. So this means that we do have enough medication for South Africans, but it's being used by the wrong people. Medication is being provided by the wrong people that are not South Africans. And we cannot go on like this. I mean, if their own, like for example, the Minister of Zimbabwe spoke in their own parliament to say that they're not going to take any responsibility for people who left their country and illegally and went to South Africa and want to use free services. They're not going to take responsibility. If people want to use if people want to get the services, they must pay for it. They're not going to be accountable.
Okay, thank you so much. Operation Dudula's President Zandile Dabula, thank you for your time and for your reaction. Of course, as we wrap up that conversation, we do continue on the other side of this to bring you more news. Stay with us.